We're excited at the office about introduction of stem cell therapy for managing inflammatory joint disease and for its regenerative potential, especially for facial regeneration of facial volume. Stem cells have been around for a while. The product and the technique we use is to use mesenchymal stem cells aspirated from the hip, the posterior superior part of the hip. It's a relatively simple process, and then that once the bone marrow has been obtained, it is spun and through a centrifuge and then filtered down to a concentrated fraction of mesenchymal stem cells as well as some platelet-rich plasma, which both of those products function as the stem cells are essentially the seeds, and then PRP, or platelet-rich plasma, is the fertilizer to help it grow and perform its function when it's introduced into a particular tissue. Common tissues that we might introduce this into would be any joint that has degeneration, that has had tears or has lost cartilage. If there is bone on bone and no cartilage left, there's really not very effective in that situation, but anything prior to that can have a significant impact on regenerating function and controlling pain. The mesenchymal stem cells themselves have to be primed to function properly, and that process is really something that takes a 2 to 3 month process of managing diet and nutrition, optimizing metabolism, controlling glucose if it's abnormal, minimizing inflammation. All of those are accomplished through our process of managing with peptides, lifestyle modification, to get the human machine working as efficiently as possible. It's known that mesenchymal stem cells, whether they're from a newborn or from an old person, have a potential to have have a potential to perform the regenerative function in the body, but the younger ones work better. So we can't really make your stem cells younger, but we can make them work as efficiently as possible. The product that, as it's obtained from the hip, is the person's own stem cells, and it's just optimized in a 2 to 3 months process prior to that to function at its best. Once a patient has been identified that may benefit from a regenerative joint procedure, a diagnostic ultrasound is performed in the office by myself to assess the joint for what the particular abnormalities are, to look at the presence of cartilage. We'll review any previous diagnostic studies, and again, if the patient is bone on bone, they may not be a good candidate for this procedure. Once that has been done, though, the bone marrow aspirate is obtained from the hip, concentrated, spun down, filtered, and then placed in the joint. Prior to any of this procedure being undertaken, the patient is recommended to go through a personal transformation plan, which includes nutritional management, lifestyle management, hormone optimization, the use of peptide therapy to optimize metabolism, and help the patient be in the best shape possible so that the stem cells, when they are obtained, have the best potential to perform properly once introduced into a joint or into the face and create the maximum regenerative possibility. Over time working with patients, many of the patients experience significant weight loss and body optimization with improved muscle density, bone density, and loss of body fat. Sometimes that will cause loss of contour body fat. Many times, especially ladies like to have fullness in the face or maintenance of facial contour. The use of mesenchymal stem cells in a patented procedure called stimulation will allow recovery of facial fullness, help with fine lines and wrinkles, age spots, sunspots, improve UV resiliency over time. It's not just filling in the blanks with an artificial substance, but it's actually allowing with the stem cell the body to regenerate its own collagen matrix and elasticity and fullness in the areas where volume may have been lost. After a procedure has been performed, sometimes physical therapy may be necessary to help the patient regain mobility and strength in a joint. As far as the facial procedures for recovery of fullness and volume, there's a patented compounded creams are applied to the face to help accelerate the recovery process. After the stimulation procedure, the patients will use a specially compounded topical and use of systemic peptide therapy, as well as curated topical skincare to help optimize recovery and results from the procedure.